Hi, guys. Welcome to TCCW Live. We are here with our special guest today, Dr. Anna Rosa, who has plenty to share, plenty of knowledge, and amazing things ahead. So, welcome, Dr. Rosa. Also, everybody else here, Joe, Philip, anybody who's watching in the background. So, Dr. Anna, if you will, give us a little bit of an intro. How did you end up in the carnivore, animal-based, whatever space you want to call this place? How
Yes,
did you end up
place
over here?
of a revolution for health and life, where we are changing the beliefs and debunking the myths. Yes, that's the
Yes,
place for everyone to be.
absolutely.
So I ended up in the carnivore with live fermented food because of my dear friend, Dr. Sean O'Mara. But before I get there, which was around in 2020, I would like to give you a little bit of intro about me.
Yes.
For those of you who don't know me, I am Dr. Anna Rosa. I am a medical doctor since 1994, so for 32 years. And I am a radiologist since 1998 for 28 years. I had done my first portion of my training in Brazil, where I was born. And also, I have a PhD in medical science in Brazil. And in 2008, I moved to the United States from Brazil to cold Minnesota because I got married with my husband, Gilson, my love, my
Mhm.
soulmate, my safe place to be, my friend, my best friend, my cheerleader. And in Minnesota, I got to get like certified as a doctor here in the United States again. We have a bunch of tests to do. And then after that, I repeated the radiology residency at the University of Minnesota, where later on I got my fellowship training in body imaging, which is mainly like everything in your body except the brain and the musculoskeletal. So at that time, my husband got sick. He got diagnosed with colon cancer, stage 4. And in 2016, unfortunately, he passed away. And since this is the month of awareness for colon cancer, it is March, I would use this show to ask yourselves, ask all of you to advocate for yourself and advocate for your
Mhm.
loved ones in doing
Absolutely.
your colonoscopies. At the time my husband got sick, he was 49, so he was earlier than the colonoscopy screening time. And for younger people, unfortunately, the cancers, not only for colon, but for other kinds of cancer, they are usually more aggressive. And yeah, so it's not really good when you get the diagnosis, and the prognosis is usually like 2.5 years of life for a stage 4. And that's what my husband had, the average. So
Mm.
what I would say is now, fortunately, you can get your colonoscopy screening starting at 45 years old. Do not postpone, do not delay. Some people say, but I have to do the prep and it's so hard. And, then I have that thing getting in my butt. So, no, don't worry about that. The prep is not hard. You're going to have diarrhea to clean your bowel, but I definitely would tell you, as a doctor and as a widow who I saw my husband suffering so much, and I was suffering holding his hands. Chemotherapy, radiation therapy, cancer progressing is way worse than a prep from colonoscopy or a mammography that some women complain that it hurts too. And that thing going in your butt, you're not going to feel it because you're going to be mildly sleeping,
Right.
and bring someone to drive you back and forth because you don't want to get in an Uber without knowing who is driving you home because you're going to be semi not paying
Disoriented.
attention to yourself. Yeah. And that's it. Definitely take care of your life. And again, blood in your stool, unintentional weight loss, abdominal pain, change in your bowel habits, constipation, diarrhea, everything, you should look for your provider. And if you have someone you love, a family member that has been diagnosed with colon cancer, also remember that you are supposed to have the colonoscopy not at 45, but 10 years before the age that your loved one was diagnosed. Like my husband was diagnosed at 49. My kids, they have to have the colon cancer screening starting at 39, so 10 years before the age that the person of your family member was diagnosed. But
Mm.
anyway, I use the time of the show because I think it's much more important than me, and I don't think, I know it's much more important than me, this information. So this is me in 2016. This
Oh,
picture was
wow.
taken 1 week after my husband died. I was with my brother-in-law who lives in Brazil, and he was with me. And yes, he took this picture, and you can see like how my face was red, how there was a lot of inflammation, rosacea. I was dealing with asthma, gastroesophageal reflux, and constipation and lack of energy and insomnia, and 226 pounds, lots of visceral fat. Of
Mm,
course, at that time, I was at the worst time of my whole life because my husband had just died,
mm,
and it was like an unbearable pain from everything being shattered, right? I didn't know who I was anymore. I did not know what I was going to do next. And to be honest, the only thing I wanted was to die as well. After my brother in law went back to Brazil, the house was silent and dark all the time, except for my dog. And yeah, everything felt like it was crushing on me. And as many of you might do, I wasn't really being able to go through my pain. I was just numbing, pretending, trying to bury. So
mm,
I would wake up, go to work to pay my bills, come back home, eat, shove the food in my mouth, not knowing what I was eating, uh, just to numb the pain, the longing, the missing, the loneliness, and then I would sleep. And that was this vicious cycle and I would take medication to sleep. And that was this vicious cycle that kept me for 9 months. Then one day, this person who is the same person I am, I'm not different from this person. We are the same, right? We have the same triggers, we have the same fears, the same
mm,
doubts, the same false beliefs, the same false stories, right? The triggers that kept this person alive were the triggers that keep me alive, right? The fear of being abandoned, the not being enough, the imposter
mm,
syndrome, all both of us, we have the same. This person was numbing. This person learned to pause, use awareness, and shift, claim my
mm,
power. Not because the triggers disappeared, because I grew around the triggers, right?
mm,
So 9 months after, this person was looking in the mirror, and also, like, I had a friend who was a plastic surgeon, and he'd had just died by suicide. And I just got everything that he used to eliminate his life, and I had everything in my bathroom with me. I had the surgical material, I have the scalpel, I have lidocaine, and I was looking in the mirror, and I was hopeless, and I did not know how to take the next step. In that blink of a moment, not even 3 minutes, my dog was all huffy puffy nervous, and he made a lot of noise, and I looked at him. Looking at him saved my life because I was able to think, oh my God, who is going to take care of him? And at that moment, I thought about my grandma teaching the young Anna, 7 years old, afraid and scared from my parents divorcing, for me always to hold on to God and to pray, but not praying, just talking to God. So in that moment, I just started crying, and I didn't pray. I just begged for God to hold me, to hold my hands, to help me, because I did not know how to keep living anymore. And I want to cry because I really did not know how to keep living anymore. I couldn't do that life anymore. And I didn't want to eliminate my life, but I wasn't seeing any door. that I could keep walking through it. So I started researching about gratitude. No, I started researching about grief, and then I got to gratitude because I started learning that. And first I learned in my brain, and then I had to learn in my heart. So I was knowing, and then later I had to know in my heart. So I started uh, questioning, is my husband really lost? No, my husband is not lost. His body is not here, but his soul, his energy, the memories, the love are always with me.
Mm,
Am I really alone? No, I'm not alone. I have my grief friends. I have my husband. I have my family. I have my dog. And I have God holding my hands. And by questioning and questioning, I was able to finally see with my heart and my soul that grief was a teacher and a reminder of the
mm,
love. So I wouldn't trade the love I had with my husband for not having any grief. I
mm,
would dive deep in the fire of grief over and over and over again because I had the love of my husband.
mm,
So that's the gratitude, right? The grief is the teacher, the reminder, the fire of hell that I had to walk through. But gratitude was the bridge that allowed me to feel the love and be in the foundation of love and
mm,
challenge and challenge and challenge because grief will never end, right? Grief has no final destination. So at that time, simultaneously, I also started learning about low carb, paleo, keto, and I was doing everything, but I was like in this yo-yo pattern. Gain weight, lose weight, 206, 198, 176, 198 again. Because all the time I would have my triggers
mm,
instead of going through them, I was eating them again,
mm,
right? I kept eating them. And I had many triggers, like if someone would tell me, you're looking good, you lost some weight, I would immediately eat for me to gain weight again because I had been sexually abused in the past. So I did not want to look good because
mm.
I thought that being fat or overweight would protect me, which is a
Mm.
lie, right?
Yeah,
The
it
false
is.
belief, right? Because I was, yeah. So anyway, one day God held me and shaked me again and shook me again. And I was opening my fridge and I already had met Sean O'Mara and I already had learned about visceral fat, the importance, and we're going to discuss this here. And I already had learned his strategies, but I was like doing it half ass, right? You put half
Yeah.
effort, you get half results because I
Yes.
was doing my triggers, right? So one day I am opening the fridge and I am like, wait a second, this health journey is exactly the same of the grief journey.
Mm,
Everything that hurts will keep hurting forever. There is no final destination.
mm,
However, the power is mine to decrease the influence of the what is hurting and shift from pain to peace, from fear to love, from doubt
mm.
to certainty, right? So this
Right.
will never disappear. The triggers will never disappear, either in grief, either in a relationship, either in health. However, when I challenge and I use awareness and my own power from my soul being wonderfully and fearfully made, I decrease the power of this and I increase the power of this. And then over and over and over again, this is going to happen less often and this is going to last long, less this is going to be less long, right?
Yes.
With less duration. And that's how I realized, oh, I'm opening the fridge. Am I hungry? Am I thirst? Am I hungry? Would I eat like 10 cans of sardines? Am I thirsty? And then I drink water with electrolytes and see if I feel better. Or do I only need a hug?
Mm,
Because I am feeling alone, bored, angry, anxious, irritated. Anyway, and that's why I say, and let's hug ourselves. And that's why I always say, I'm sending a hug to you from my heart. Because if you are only needing a hug, I am sending you a hug, and you can hug yourself together with me.
Mm.
And that's when I started building sustainable success. And that happened around 2023, when I definitely started like questioning my feelings, my emotions, my false beliefs, my thoughts, and I started shifting and building awareness and, solidifying my mindset to help with the body strategies for breakthroughs, right? Nutrition, movement, and stress hormesis. Because nutrition, movement, and stress hormesis, we have all the knowledge. Although nowadays we have, to be honest, too much knowledge, which I tell people you have to triage the knowledge that is proper for you, experiment. Otherwise, it's just overwhelming stress and
Mm.
more cortisol, right? So find your tribe, find your mentor, find your coach, find your guide, and then follow that wisdom and experiment together, holding each other. And these we have, and we decrease the noise. And with the mind connected to your soul, you are able to build a solid foundation to keep building sustainable success and with progress, not perfection, and with
Mm.
compassion. Because some days are going to be harder, right? And in these days, if you don't have compassion, you're going to feel like you're failing, and you're not failing. The process of this day is harder, or
Mm.
you're going to feel guilt, or you're going to feel shame, and there's no reason for that, because you have until eternity to keep improving, right?
Yes.
So yes. So then, as a radiologist, I started working and looking on how the disease starts, which
Mm.
is starting in your liver, is starting in the receptors getting malfunction, right? And then inflammation and visceral fat, and then fat surrounding your heart, and then inflammation in your brain, and microvascular and vascular dementia. But let's keep talking, because now that I talked about me, I'll let you ask whatever you want. And thank you so much giving me the opportunity to tell you
Mm.
from the beginning what is really important for me, because that's why I am here. I am not here to just be one more person talking about visceral fat, fatty liver, and nutrition and movement. I am here because I know how it is to feel broken, shattered, destroyed, suicidal, and also feel like I'm doing better and I'm getting worse. I'm doing better and I'm getting worse. And that pattern that never ends. And I know that each one of us have the power inside of us, because we are wonderfully and fearfully made and unique. And I'm really doing this from my heart together with my husband in
Yeah.
heaven.
How beautiful. Um, cannot tell you how lovely it is to hear, um, just the sincerity in your words is really it's like, I don't I don't it would matter what any person believes as far as their belief system, the love and sincerity that you have when you're speaking comes through and shines beautifully, and that is so lovely to experience.
Thank
So,
you.
I am just as honored to have you here. Oh,
Amen.
yes.
We are
So,
hugging each other.
yes, big hugs.
Yes.
So, I see Joe over there. What you got for me, Joe?
Well, first of all, I want to say that I really love the visual aids, and I'm gonna start doing that too. That's awesome. Um, but what I really wanted to touch on, Dr. Anna Rosa, is that I think what people really should take away from that is that people think when I eat, it has to do with a lot of just a physical response, but there's more. There's the emotional, there's the spiritual, there's the basically those aspects to it. That food does affect us that way, whether it's emotional, spiritual, and the aspect that, like food can heal us, it can also heal us in the aspect of helping us with those, feelings, with those emotions, with those triggers, with basically, um, those aspects. Because I deal with a lot of individuals that have eating disorders, and they're in pain, right? They have these disorders because they're dealing with pain, that whether they were abused, whether they were hurt, whether they're upset, whether they have family issues, food's comforting them, right?
Mm,
And that's a thing people kind of miss, is that like, a lot of people don't use drugs or alcohol as their dependency. They'll use food because it makes them feel euphoric, it makes them feel good, it comforts them. And that's never really food's design. That's more of a food company design, but it just kind of rolls into that. Um, so yeah, I thought it was awesome you sharing. I can appreciate that, and I love the fact that more people need to understand that food just doesn't affect you physically. It does affect you kind of emotionally, spiritually, and that, yeah, it's
mm,
just even sometimes acknowledging that, right? And understanding that food does have a big part in it, right? Like, you can have days where you're having a great day, all of a sudden you eat something, and all of a sudden your day's not going great, and people don't realize it was based on what I ate, right? Because I got that hormonal response, right?
mm,
And then it ended up with that emotional response. So yeah,
Yeah.
that was awesome.
Thank you. And it's absolutely this. Like, I know that our body is the vessel for our soul. What is really our prime foundation is our soul. That's how, when we are going to die, we're going to drop this body in gratitude, and we're going to be energy, and we're going to go to heaven, whatever faith you have, God, the creator, the universe, the higher force, the power, whatever. But energy doesn't go away, right? So
mm,
your energy has to go someplace. And when you honor your body, when you take care of your body, you are honoring this energy that is eternal, right? And this energy is what is supposed to guide you. That's the energy where you were born as a baby, joyful, like no fear, no doubt. But when we start growing up, then be quiet, don't talk too much, stop eating this, or, clean your plate, or, you have done this wrong again, or your parents divorced, or you are being abused, or you have parents that are alcoholics. All this is kind of imprinting in us.
mm,
So now we are not responding from the goodness, the joy, the light, the love that we have in our hearts anymore. We are reacting to what is around us. So then we are not going to be expelled. We are going to belong. We are going to be accepted. We are going to be silent,
mm,
invisible, and quiet, right? As much as possible. And in these moments, that's when we start building the connections of what's going to give us comfort, right? So some people are going to go for sports, some people are going to go for food, some people are going to go for alcohol, some people, yeah. And food is really common, because what do you do? What do your parents or grandparents do when you are crying? They give you some food, right?
mm,
Now they are giving you a phone or an iPad. So the addiction, the comfort place is technology, right?
mm,
And to be honest, I don't know which one is worse, because the technology isolates you even more, right? There is the depression, the comparison, and then it's escalating, but not going there. So definitely paying attention that food, no, definitely paying attention that what felt comfortable when you were little is not comfortable anymore, does not need to be comfortable anymore. You just have to really feel in your body. Your body is your compass, is your God's given barometer, right? Just feel in your body when you are expanding, when you are contracting, when you are feeling joy, gratitude, love, or when you are feeling fear, doubt, you know, despair, loneliness. And then you're going to feel like a tightness in your chest, in your throat, in your belly. And you know that you're not in the place you're supposed to be. And at that moment, if you pause for like 9 seconds, 9 seconds, you are able to question, and you are able to start shifting slowly but surely. from the pattern that doesn't belong to you anymore.
9 seconds.
Totally
Man,
agree.
what can change in 9 seconds?
I know, yes.
Mm.
That's I don't know. I don't remember if it's a Harvard or if it's a Stanford University research. I can't remember, but the 9 seconds is a real number.
Yeah.
Yeah,
No, I've heard it before somewhere as well, so it's, just reiterating the realness that that's not just something, that's in my head somewhere.
yeah. And in
Like,
this
I've
time,
heard that before.
this little amount of time, you can choose differently. So then you choose from your power, you choose from your peace, you choose from your love
Mm.
instead of the fear. And like you can hug yourself, you can go for a walk, you can text a friend, you can, get a shower, and or you could open the fridge and shove food in your mouth. But the thing
It's
is,
an option.
when you are opening the fridge after pausing
Mm.
and you are deciding that at that time you are still going to eat, that's completely different because you are making a conscious decision.
Mm.
You are not eating to numb something like unconsciously. You are
Right.
eating consciously, and but now you know what is hurting you, and you
Mm.
could go through that whenever you want to because it's going to come back, because
So true.
the lesson that you don't learn will keep coming back, and the lesson
Yeah.
that you learned but will still come back for you to keep decreasing its power. Yes.
My,
Yeah.
uh my mom used to say something very similar about relationships. You know, you don't leave someone because of how bad the situation is. Not saying nobody should ever leave their situation, but you don't leave someone because, you don't like what everything is. Because the reality is if you don't heal the problem, you're just going to marry it or date it in someone else. It'll
Mm,
be the same problems, the same issues. It'll just be a different body who's bringing it into your life.
yes.
And it's like the reality that it's not them necessarily bringing it into their life, it's your unhealed issues
Yes.
that is attracting these people with these similar experiences, and it's the same thing with, like, what you're describing with our food and what we do with ourselves and how we manage our own physical being. It's the same. If you are not willing to do the work to repair yourself mentally, emotionally, spiritually, whatever aspect it is, your physical being will express that in its entirety,
Yes.
for sure.
And if you are not willing to heal or walk through the pain, I used to say, I say it in fact, you have to walk through the hell of fire so then you could become the fire yourself, right?
Mm, I like
Get
that.
the energy yourself. So if you don't walk through the fires of hell to become the fire, uh, you will lose weight, you will leave the relationship at some point,
Mm,
and you will go back to the weight, and
mhm.
you will go back to another relationship later on because your thermostat, you haven't adjusted your thermostat to the new temperature you want, right?
Yes. Oh, funny.
So so the one of the things I always tell myself, like when you have challenges and stuff like that, a lot of it's done for you, not to you. So God always does things for you, not to you. It's a lesson that you have to learn. And another analogy, I think it's an analogy or something where, when there's a rainstorm that's coming to you, if there's a, related to carnivore, if there's a herd of cows and there's a rainstorm coming toward them, you know, they don't run away from the cloud, they run towards it. Because
Mm,
the more you run away from it, the longer you stay in that storm. Where if you run through it, then you could actually overcome it a lot faster. And so sometimes you have to get the courage to overcome that fear. And one of the first things that everyone has to understand is the awareness, right? Being aware of that emotion, being aware of all that feelings that you have that comes up if this gets triggered. And that's why the whole 9 seconds makes sense. In the Kabbalah, if you guys, whoever is Jewish and if you study the Kabbalah, that's one of the first steps to do is actually being aware. Hey, I'm having this emotional feeling that I don't like. I'm aware of it. Okay, now how do I respond to that? You know,
Yes.
sometimes you could pray at that time, have the creator, whoever you believe in, say, give
Yeah.
me the energy to, hey, I want to overcome this. Give me a sign or something to help overcome that. And
Yeah.
that's for me, I had psoriasis for a long time, and carnivore it's a miracle, just to be able to I know that if I keep staying on carnivore, my skin will be better, everything will feel better, and I'll be less stressed about things. And you know, if you go in the scientific route, the hormonal and emotional stuff that comes from our food. And with my pre-carnivore, my standard American diet was instant noodles and ramen and stuff, carbs that actually triggers all that stress, cortisol and stuff
Oh.
that makes you go crazy.
Yes.
So
Mhm.
So I like what you said because we are talking about awareness, awareness, awareness. And I don't know who, but one person once asked me, but how do I get awareness? Because there
Mm.
are words that seem so like fluffy, fluffy in this space, right? So
Yeah.
awareness is just pay attention. Pay attention. That's awareness. Pay
Mm.
attention to your body. Pay attention to how you're feeling. Again, pay attention if you are feeling good or if you're feeling like, ugh, you know. Pay attention if you're breathing or if you're constricted. When you pay attention, you know if you are in a situation of pain or if you are in a situation of peace. And when you are in a situation of pain, that's when you can ask yourself, not why is this happening for me? Why? But what does life want from you? What does God want from you? What does your faith want from you? Or what is going to happen to me in 1 year, 5, 10, if I keep acting on this instead of shifting from this? What is the price? What is the good price or the bad price I'm going to pay later on? Because we are going to pay later on. What are the consequences from your actions, right? So always Dr. Daniel Amen, I love what he says, is like choices. When you are making a choice, ask yourself, does this choice love me back?
Mm.
Because you could love drinking. You don't, but you do not. Trust me, you do not. But you believe that you love drinking alcohol. You believe that you love smoking. You believe that you love porn. You believe that you love not doing anything, sitting and watching TV. You believe that you love your carbs, but you do not. But even when you believe that,
Yes.
ask yourself, does this alcohol love me back? Does this porn,
Mm.
does this smoke, does this binging addiction loves me back? If the answer is no, that's when you are invited to change the perspective. One step at a time. It's not about, oh, I'm going to do 100% right. None of us are going to do 100% right because we are
Mm.
right. But one by one, by one, by one, we start shifting the direction. I heard someone saying once that this person was talking about a big ship in the ocean. And my ADHD brain was, oh, yeah, we are a big ship because we are our souls, and our souls are extremely eternal. So when we shift 1 degree per month, not even going to say if we shift 1 degree per year, we are going to end up in a completely different position, right?
Mm.
It might be hard to shift like 10 degrees for a big ship, but you can shift 1 degree, 1 degree, 1 degree, 1 degree, and suddenly you were supposed to be in, you know, New York and you are in Los Angeles. because it completely changed the direction of your life. And that's you. You are the only one who can do that. And like
Mm.
you're saying, the way that we choose of eating with the carnivore or low carb or keto or strict keto or carnivore with fermented food, when we take away everything that is damaging us, which is the carbs, the processed foods, the sugar, the alcohol, the vegetable oil, the milk, the juice, all this kind of stuff, we go from healing, we heal our livers because it starts here. You are eating all this junk food, and by junk food, I'm not saying only McDonald's or pizza. I'm saying all these, the carbs, the processed food, the alcohol, the vegetable oils, the sugar. So it starts here. It starts overloading your liver. And at some point, your liver is not functioning properly anymore before even getting worse and worse to fibrosis and cirrhosis and even liver cancer. But at some point your liver says, I can't do this anymore. I'm not functioning properly anymore. And keep in mind that everything is happening at the same time, okay? And then your liver starts releasing sugar and triglycerides in your blood. So the sugar makes the pancreas release more insulin with the insulin resistance, but all the cell receptors in your body, the whole body, the brain, insulin resistance type 3 diabetes, the body, type 2 diabetes or pre-diabetes, the bowel, Crohn's disease, inflammatory bowel disease, gastroesophageal reflux, your lungs with asthma and bronchitis, your heart with heart attacks and coronary vascular disease, right, and atrial fibrillation, your pancreas with the insulin resistance I said, the muscles, you're losing muscle mass and you're losing bone and you have osteoporosis and you have fractures and you become with sarcopenia and you cannot even get up from your toilet anymore. So this releases increases the sugar and the triglycerides, and then, like I said, you have inflammation in your brain, you have vascular dementia, you have insulin resistance diabetes type 3, you have deposit of tau and amyloid with Alzheimer's. You have cardiac disease. Everybody wants to look at their coronary calcium score. They should look at the fat that is going to produce the coronary calcium score like 20 years later. Way before you have the coronary calcium, you have the coronary plaque, you have the fat damaging the endothelial of lineage of the arteries. And then this is me. You see all this visceral fat, that's the white inside the abdomen. And this is cytokines 24/7, cortisol, cancer, everything that it's not good. And then you start doing the strategies. You go from having, this is me, you go from having fat surrounding your heart to zero fat surrounding your heart. And then you go from being really inflamed to much better, but still room for improvement because there is always room for improvement. So if you are attached to a final goal and the final goal seems too far from you and it makes you feel kind of like disappointed or overwhelmed, just don't think about your final goal because your final goal is going to change.
Hmm.
There will never be a final goal because you're always going to be improving. You will always going to be improving.
So with the pictures you're showing, what would be considered healthy, right? So like if I know it's a cross section X-ray type thing.
MRI.
MRI, my bad. Yes. So it's a
So
cross section, right? So how can someone who's got
so
their
this
MRI?
yes. So this is sick, right? So you are not supposed to have any of this white surrounding your heart. This is inflammatory, the same way as visceral fat, and it's epicardial adipose tissue, and it's related to cardiac attacks, and it's related to coronary vascular disease, aorta aneurysmal dilation, aorta dissection, all these kind of things. So then when you do the strategies of carnivore fermented, and the exercise, now you can see that there is no fat surrounding the heart. So that's how you want. You do not want fat surrounding your heart. That's the normal, okay? I don't have fat surrounding my heart anymore, and I'm showing you my images. However, in the abdomen, it's me again. you have, when I started, you have all this fat inside of the belly, and this is visceral fat inflammation. And you can see that the oblique musculature is very thin and lots of white too, because it's fat, right? Intersperse the muscles, the myosteatosis, and then you start doing the strategies and you start reversing the visceral fat and the disease in your body. So I still have visceral fat, but you can see that it's way less white, right, inside the abdomen. So, but I
Oh,
still
wow.
have visceral fat. Technically, you would want this side here would probably be almost normal because you still want more, less than that. You want zero, but that's progress, right? That's a process. And you can see how my muscles already improved. They are way thicker and way darker because the fat is being replaced by doing strength training, right? And that's it. That's here, way thicker and way darker. So the good one, I wouldn't say the normal. I would say the good one, the healthy one, is the less visceral fat you have, the better. The more muscle you have, the better. The more muscles, the more bones you have, the better. And also later on, burning the deep subcutaneous fat. So that's why I say, and Sean says too, that the MRI is what's going to show you the truth, because the MRI shows you the quantity, but also the quality, the location of the visceral fat, of the fat, right? If it's visceral, if it's in the muscle, if it's surrounding your heart, right? The MRI shows the amount and the location. Maybe it's a good idea to have an MRI once a year, right? And then you are going to follow your until you get back, until you get healthy, right? Just as tracking. And then you follow your progress, your trajectory. You could follow with a bioimpedance, you could follow with a DEXA scan, because then it's going, what you want is, yes, I am decreasing fat, and at the same time I am increasing muscle and I am increasing bone mass, because you don't want to decrease fat and be stable, or decrease muscle and bone mass, because then you are not, you are like taking away from your body the muscle and the bones that are important for your metabolism, for your brain health, for your mood health, for your independence, for your functionality, for your strength, right? You want fat going away and muscle and bone improving. And for people who think, oh, but I'm old, that doesn't happen, it is a lie. I am 55 in 2 weeks. I'm going to be 55. And you can see that I am building muscle. And I am not like Joe, going like, I am not. I do my strength training 2 or 3 times a week, and it's 1 hour only. And I am building muscle, and I am
Well,
menopaused, right? So,
yeah, Dr. Anna, I actually want to jump in here because I have a question for you, and I'm glad you brought it up just a few minutes ago. You talked about sarcopenia because I had two questions for you, and that was on one of them. And I really want to take the opportunity having you on to talk about, it was like I've been doing this for a bit. I'm old. I'm 58. I remember 20 years ago, when we saw people with sarcopenia, they're in their 50s, their 60s. Now we're seeing it onset in women in their 30s and their 40s. And I really think with the low protein, the low fat, and the high carb diets, that's why we're seeing it. But I really want you to talk about the importance of protein, especially for women,
yeah.
and what that means to muscle mass and bone density, and why it's important for them to basically make sure they're eating enough of it, because that's the first place they can start. And then obviously incorporating some resistance training 2-3 times a week, which will maintain and promote that. So if you can spend a few minutes on that, that'd be awesome.
Yes, I like that you brought the awareness that people are having sarcopenia way younger, because it's not only sarcopenia. People are being diagnosed with prediabetes, diabetes, and atrial fibrillation way younger, and everything is inflammation related, right? So, lipomatous hypertrophy of your interatrial septum in your heart, where you have the electrical conduction, is replaced by fat. Of course, it's not going to work well because the fat is not where the electrical conduction cells are supposed to be, right? You are replacing the muscle, the area that you have that electrical conduction system, by fat. Atrial fibrillation. You are not doing anything. You just stay sitting and playing video games and watching TV and working seated, sitting all day working, and you are eating lots of carbs, you snack all the time, you drink to get less stressed, and then you take medication to sleep, you don't go out, you don't go outside. So you are doing everything that is destroying your body. And your body
Mm,
just wants a chance to heal, right? So I would say, and also for these people, they are so inflamed that all the hormones are not well, like they are not really working well, right? They
mm,
have problems with thyroid, they have problems with like insulin and glucose, they have problems with their sexual hormones, right? So like people that are 35, 40 years old, they complain of erectile dysfunction, right? They are
mm.
supposed to be in their prime and they are complaining of erectile dysfunction,
Uh,
which I
I've
don't think there
I've
is a prime. I believe that,
I have clients in their mid 20s complaining about ED. Never mind 35. It's even lower, right?
yeah,
And you're 1,000% right. Like the longer we get in, we're seeing a lot of these things that should happen much later,
yeah.
happening earlier and earlier and earlier. And the reality is, it's because we're not consuming enough of the things we should be on a regular basis.
Are consuming everything we
Mhm,
shouldn't. And when we get to 20 years old, we are, our bodies are the bodies of the 60 years old in the of
mm.
prior generations,
Yeah.
right? Because
Right.
if you look around, young kids now that are 10 years old, they are obese already,
Absolutely. Well,
right?
I want to, because I unfortunately have a client at two, so I got to go. So there's two things I
Oh,
wanted to ask you. The
yeah,
one thing about the muscle mass women
yeah.
protein, and I
So
wanted to speak on that just so people can do it. And the other thing I wanted to ask you, and I probably won't be on when you talk about it, is, um, since the 1970s and the demonization of basically, meats and fats, and then all the fear mongering with heart disease, uh, the importance of saturated fat and especially cholesterol and how the role of cholesterol, especially hormonally, because what I've noticed with my clients, like I have women, I have two women now, 18 and 19, perimenopausal, menopausal,
wow,
right? Like it's crazy. Like, and even that, I remember 20 years ago, if you saw a woman in her 40s perimenopausal was a big deal. Now
yeah,
it's 30s, 20s, and teens. And the thing I recognized, like when I did the lifeline for both of these individuals, their mothers were chronic dieters, low fat, low fat, low fat, low fat. Then the fat they were getting were trans fats, right?
yes,
Um, they weren't saturated fats. And, like, so I wanted you to touch on that just while you're here, because I've watched some of your videos and you do great videos on it. So I just want everyone to be aware of that watches this podcast. Just the importance of basically saturated fat, the importance of cholesterol when it comes to hormonally, especially for women, because I
yeah.
think a lot of them are scared of saturated fat, and their only relationship with thinking of fat is it's going to make me fat,
Right.
and they don't realize it's not necessarily going to make me fat, but I need it, right? Especially hormonally, right?
I would
Um,
say if you are adding fat to your diet, to your way of eating, because I don't like to say diet,
yeah.
but you are still eating a diet that is inflammatory with sugar, alcohol, vegetable oils, lots of carbs, complex carbs, processed foods, is going to be poison because you are
Mm,
mixing poison, you are mixing this really poison here and this kind of connects here and doesn't help much, right? So first of all, I would say you have to take away from your way of eating everything that is inflammation productor, right? So you have to take away. Go to your pantry and clean it right now while we're talking. Sugar,
get up.
processed foods, ultra processed foods, alcohol, complex carbs, vegetable oils, seed oils, juice, milk, and I think I said everything, but I'm not paying attention. But anyway,
Yep.
yeah. So you have to take away all this. If you still want to eat carbs, you are gonna eat low carb. What is low carb? Less than 50 grams a day or less than 20 grams a day. And you're gonna use that with carbs that are low glycemic index. The less
Right.
carbs you have, the more results you're going to have. Again, you get the results from the effort that you put.
Yeah.
If you are very inflamed and very sick, I would say the stricter you go, the better, at least for 3 months. So then you clean your body. You give your body a chance to breathe again, right? So after you take away all this, what am I going to eat? You are going to eat fat of good quality. You're going to eat lard, you're going to eat butter, you're going to eat ghee, not margarine, butter,
Yeah.
ghee. You're going to eat like I help me because I'm olive oil,
Tallow.
avocado
Yep.
oil, tallow.
Tallow,
That's what you're going to eat, okay?
duck fat.
What do you feel about coconut oil?
Uh I think it is good, but I don't use it much. So I don't
Mm.
know very well to give more details. To be honest, I haven't read about coconut oil. Yes. I have heard that it's really, really good, but I haven't read deeply for me to give my opinion with honesty. So then you're gonna eat protein. Protein is not negotiable. Protein is 1.6 to 2 grams per pound. Protein is not negotiable. Sometimes I am not able to eat protein with food only. And I do have protein, and I know that lots of people don't like this, but my protein is not negotiable. If I'm not able to eat all my protein with eggs and meat and fish and good protein, I eat my protein powder that is good quality, Equip or my Body Mind Green, and I grass fed, grass finished with natural yogurt or kefir, very little. No, the yogurt doesn't have sugar, doesn't have flavor. Okay. Why is protein? And protein should always be the first meal that you are interrupting your fasting. Protein is the first meal that you are interrupting your fasting. Fasting, you should start slowly but surely and get to 16 or 18 hours and then do extending fasting like 24, 36, 48, 72, but slowly but surely. Okay. Why is protein and fat, why are they so important? Because they are the source that every cell in your body needs to regenerate, to produce new cells.
Mm.
So you cannot produce new cells or energy to your mitochondria if you don't have amino acids that come from protein or if you don't have fat, right? And on that note, you should always know as well your levels of vitamin D3 because vitamin D3 is a precursor in the role of cholesterol and steroid hormones. Steroid hormones are your sexual hormones, okay? And B12 and magnesium. And when you are taking vitamin D, B12, and magnesium, you should take them together because, and K2, because they protect your arteries. If you do not follow these steps the way we are talking about, if you keep the things that are poison, you are going to create inflamed cholesterol, oxidized cholesterol that is rusting your body from inside out. You do not want inflamed cholesterol that comes from high insulin, high sugar, abnormal liver function, and elevated cortisol, and elevated triglycerides, and elevated LDL, especially small particles, and decreased HDL. However, when you take away all the poison that we talked about, you can review back, you are healing your body, decreasing insulin resistance, improving liver function, decreasing sugar, decreasing cortisol. So your body is reversing chronic inflammation. At
Mm.
that moment, your triglycerides will go down, your LDL will go down, your HDL will start going up, and your cholesterol will be healthy. And you want your cholesterol healthy, to be elevated. Why? Because cholesterol, vitamin D3, protein, they are all important for the health of your mitochondria, which is the power energy for your body, producing the ATP, the energy that keeps you alive, improving the brain function, the cognition, the memory, the decision, the focus, the attention, covering the cells of your nervous system because it's myelin. You need myelin. Myelin is fat. Your brain needs fat. And all your other cells in your body, the muscles, the bones, bone marrow. What is bone marrow? It's fat, right? So you have to improve your good fat, improve your protein, improve your cholesterol, so then your body will be working perfectly.
Awesome.
So not negotiable to eliminate everything that is poison. So then you can add everything that it's not negotiable healthy. And then you can calculate your macros experimenting with yourself, because what works for Dr. Rosa is completely different from what works for Joe. And it's completely different from what works for Selena and Philip and you. So you have to experiment with yourself to find a balance for reverting, for decreasing your weight, gaining muscle, gaining bone, and yes, and that's how you do it. Good fat, good protein, your own macros according to what you want for your goals, and yes,
Yeah, that's
that.
awesome.
I hope it
And
helps.
Clip
well,
that.
yeah, like I wanted them to hear it from you. And just for the simple fact that, we talk about a lot of the same stuff and we talk about and we try to educate people out there and educate our clients. But sometimes they just need to hear another perspective that, cholesterol is important. It's healthy for you.
It's so important.
Protein. And I love the fact you used it's a non-negotiable because it's not. It is a non-negotiable, right? Like,
And
you know,
cholesterol is not negotiable too. The good health
absolutely.
cholesterol.
Absolutely.
Healthy
And
cholesterol is not negotiable. It protects your arteries. It protects your endothelial portion of your artery, line of your artery. And if you want to improve from erectile dysfunction, if you want to improve your libido, because people care more about that than about their brain, if you want to improve that, you definitely need good cholesterol and good
yeah,
protein. But again, if your cholesterol is inflamed, you're shooting your foot.
absolutely. Okay, awesome. Thank you very much, Dr.
Thank
Anna Rosa. I have to leave. It was nice meeting you, and I'm gonna watch it, the whole thing later when I have a chance. See you guys. Thank you.
Bye, Joe. Thanks for coming.
No problem.
Bye, Joe.
Bye.
Bye.
Okay, so there was a question, and I'm going to put it up here if you're able to read that. It says, my dad passed away 2 years ago. I'm not even going to try to say that. He had amyloidosis,
Yes.
calcium deposits in the organs. Does Dr. Anna think carnivore might have had an impact? I feel like I could have helped him a lot if I knew.
So I believe that carnivore has a positive beneficial impact in any kind of inflammation that you have in your body, because it is going to decrease the chronic inflammation. So then you are going to be having improvement and reversing disease like multiple sclerosis or asthma or epilepsy or psychiatric problems, right? So I do believe that carnivore could have helped your dad. However, in the second portion of the the paragraph, your phrase, your statement is, I feel I could have helped him a lot if I knew. I just want you to put your hands in your heart and release that, because this is a guilt that is very heavy. Even if you don't feel that it's guilt, it hurts. Because I have been carrying the feeling that because I am a doctor, I could have diagnosed my husband from colon cancer before, and maybe he wouldn't be dead because it would be earlier in the staging. And you know, we do in each time of our lives according to our knowledge, and we are doing our best at each time of our lives. You could have done different now, but now it is a different time. So at that time, with what you knew, you did your best, and you know what your dad really needed? You with him. Your presence, your heart, your care, your love, your attention, your hugs, you holding his hands and talking to him, and your honor and your respect and your gratitude. Because, on a side note, none of us are eternal. No carnivore diet will make us live forever in our bodies, right? But your dad is living forever in his soul, and he is together with you. And I do believe that although we could improve our health span with the carnivore diet, the lifespan, the amount of years we are going to live, only for me, I do believe only God knows. And that is the plan for your soul. You know, you're going to live X amount of years because God agreed on that for you. And it's there in your life book. My husband, myself, Selena, and Philip, we are going to live the amount of years that God gave to us. And we might be able to negotiate here and there if we are really good, like King Hezekiah in the Bible. He was able to negotiate 15 years more. But that was a negotiation between King Hezekiah and God. That would be a negotiation between your dad and God. You are not, and I am not, more powerful than the plan of God and than the plan of the soul from my husband and your dad. It is really hard to accept, to surrender to this. It's not even acceptance, it's surrendering. It is really, really hard. But it's the only way that you can hold on to the gratitude for the love, for the life, for the teachings, for him being your dad, and for knowing that he's always with you. I hope this helps.
Yeah, for sure.
And he's saying too that coconut oil is great for hair. I know it is. And coconut oil is great for doing pulling for your teeth too.
Yes, yes, for sure. So, Philip, do you have any
I,
questions
I
or?
have a lot of question actually. So I'm gonna bring this all the way back
Okay.
to your husband. Rest in peace for him. And um, but the colon so the colon cancer. So me being Asian, and I'm trying to sort of cater to the Asian population here because a lot of Asian people eat a lot of his spicy food. So like Thai people, Koreans, and if you didn't know, a lot of Korean people who eat kimchi every single day, which is spicy fermented vegetables, um, they're known to have colon cancer as one of the top. I don't know.
Mm,
There's a study, there's a research done. Like one of the top issues for a lot of Koreans is having colon cancer because they eat so much spicy food. And so I don't know, have you done any research on understanding like what actually caused the colon cancer that your husband had, and like maybe you could share like why people need to sort of be careful what they eat. We already talked about what they eat, but more like what research have you done and sort of people understand like what causes colon cancer?
So I don't know if spicy food would be a factor that would increase colon cancer. I do know that vitamin D3 in high doses is protective towards colon cancer and other kinds of cancer. There is a research from Mayo Clinic saying that around 20,000 units of vitamin D3 could be protective to cancer. But again, this is not medical advice. You have to check with your doctor because you don't want to have extreme those levels of vitamin D3 too, right? I do know that all the processed foods are related to cancer. The visceral fat inflammation is related to at least 13 types of cancer: pancreas, colon, gastric, lymphoma, leukemia, thyroid, and the female ones, breast, ovarian, uterus, endometrium, right? So, because visceral fat is producing inflammation, interleucin 1 and 6, but also tumor factor necrosis alpha, which is cancer, cancerogenous, right? I do know that colon cancer has a correlation with at least two different types of germs in your bowel. I cannot remember by head right now which they are, but again, the germs are your microbacteria, right? The germs are your bacteria, and they are usually gram negative, and the bacteria from your microbiome leads to inflammation because the gram-negative bacteria has the LAS, lipopolysaccharides, and then it gives leaky gut and the inflammation in your whole body. So I do know that there are two types of bacteria in your colon that have a correlation with colon cancer. And that's why it's so good for you to do, that's why it's so important for you to do the strategies that are going to improve and heal your microbiome. And one of them is the carnivore, and the other one is the fermented food that helps with recycling your microbiome to a good microbiome, right? That will not be craving sugar and not be craving all the thing that is shit thing, right? So yes, and I do know that Asian people also have an increased incidence of liver cancer,
Hmm.
which is correlated with iron, excess of iron in your blood. And some of them could have hemochromatosis, which is a disease that has a problem in processing the iron in your blood, and it gets elevated, and it can get better with blood donations, right? Because you are taking away excessive iron. That's why women, when they are having the menses, that they have less problem with iron being elevated because they are expelling iron in the blood. And hepatitis C. I don't know if it's better now, but I know that Asian people had a higher incidence of hepatitis C that would lead to liver cancer, cirrhosis, and liver cancer because of the hepatitis, right? But that's what I know. Pepper, spicy, I don't know, but the kimchi definitely would be protective.
Hmm.
Does that help?
Yeah, that definitely helps. That's good to know because
And
I
and
always
the
thought
screen
that. Oh, go ahead. Sorry.
and the colonoscopy screening at the proper age, and looking for your doctor if you have the symptoms that are suspicious, and because you could be 30 years old and you are having symptoms and you're going to be like, oh, but I'm not 45. Well, doesn't matter, you are having symptoms and you should go check with your doctor, because people with 20 years old have colon cancer, right?
Hmm.
Yeah. So that was my other question was like I'm 35. I'm turning 35 in at the end of the month. Literally 10 days. And
Yay! Happy early
yeah. So it's
birthday.
my birthday.
What
Thank
day
you.
is your birthday?
March 30th.
Okay, mine is April 2nd. We're going to
Oh,
be together.
yeah.
Happy birthday.
Aries. And so that's why like okay, so it would be too early for me to do a colonoscopy.
Colonoscopy.
Yeah. So, but at the same time, like since I'm on carnivore, does it can I wait till I'm 45, or should I just do it early? It doesn't hurt and just do it annually or maybe every
So,
2 years?
first of all, do you have any family member who had colon cancer?
No, none that I know
Okay,
of.
so the screening age is 45. You would have a colonoscopy earlier if you would be having symptoms that would make the doctor or you think that you could be having symptoms of colon cancer. Blood in your stool, which is not the red blood when you wipe your butt. This is hemorrhoid. But the blood in your stool is the blood that it's interspersed. It's kind of bright red, or could be darker because of the
Darker.
blood coming from an upper portion of your GI tract. Abnormal bowel movement that is not your usual, which would be diarrhea, constipation, or both. Abdominal pain, because could be like severe, like because could be a mass obstructing the passage of the stool, right? Weight loss that is unintentional, night sweats. So all these kind of things that would trigger your attention and your doctor that, oh, maybe this could be colon cancer. That's when you would be doing a colonoscopy earlier according to your doctor, and you could also check the occult blood in your stool, fecal occult blood test. um, yeah, so 45, and A colonoscopy isn't done like a mammogram annually. A colonoscopy, the interval of repeating is defined on the results of your exam. Like if you don't have anything, you might repeat in 5 or 10 years. I don't know. I think it's 10. But if you have something, a polyp, if it's pre-malignant or if it's benign or if it's malignant, then they have the criteria that they will decide, oh, you're going to come every 2 years, every 5 years, every 10 years. Okay.
So my dad does have polyps, and he got them removed before, and so should that be a concern for me or something?
Well,
Yeah.
you might have a tendency of having polyps as well. But does any of his polyps came back positive for cancer?
None that I know of. No.
Yeah, so I would evaluate that with your dad, and maybe you could go to your doctor and discuss with your doctor, hey, the results for my dad were this, and then I am not feeling this, or I am feeling this, or when should I start? Or if your level of anxiety is too much that you would rather have it just to be calm, you could discuss that with your doctor too.
Okay.
I don't know if insurance, I really don't know if insurance, because I don't work with that, right? I work with imaging.
Yeah.
This is like GI doctors, right?
Hmm.
But you should definitely discuss with your doctor your family history of polyps, your concerns, and the results of your dad's colonoscopy.
Okay. Good to know.
Yes, that would be something that you could check. Not to be worried and afraid, just to be safe and taking action to feel calmer, right?
Definitely proactive, right? Being
Yeah,
proactive, making sure. Yeah.
yeah.
I'm trying to think. And then from your experience as a radiologist, so a lot of us are carnivores and we like to do DEXA scans and stuff. Like, do you have any other recommendations or alternatives that we should look into for like?
I would say that unfortunately we don't have yet a metabolic screening protocol, an imaging metabolic screening protocol. The best imaging metabolic screening protocol definitely would be what Dr. Sean O'Mara advocates, right? The MRI of your abdomen, because then again, you would see the location, quality, and anatomic distribution, and the amount. The
Hmm.
MRI definitely is expensive. So I would say if you are able to have an MRI once a year, if you are doing your strategies to see how it's going until you feel like I'm good now, it would be a good way to follow because you engage your senses. You are seeing, you can't forget, and then you take actions. You are more proactive in taking actions, right? The DEXA, I think it's around $100. So the DEXA, some people are doing it all the time now. The DEXA is going to tell you the trajectory. The DEXA is going to tell you I'm losing fat, gaining muscle, gaining bone, which is what you want, which could also be seen with the bioimpedance, a bioimpedance of a kind of average to good quality, right? So it would be more like every 3 months, every 6 months, or a bioimpedance every month. You can do it in your gym, if you can do it in your gym. And so that would be because the DEXA gives you like total amount of fat in your body. That is telling you all the fat in your bone, the fat in your muscle, the fat in your belly, the fat in your breast, right? So it's everything. And then when the DEXA gives you visceral fat, the machine is subtracting the total minus what it believes it's subcutaneous. So technically, it is still giving a number that is not 100% accurate, right? But again, the DEXA is good to see if you are in the good way that is gaining muscle and gaining bone at the same time of losing fat. And that's the same thing that the bioimpedance would help as well. You could measure your waist hip circumference and you would see it decreasing as your belly decreases. Um, I wouldn't be, I do look at my weight on the scale, but I would be mindful that the weight on the scale is completely not value. It's just, yeah, you shouldn't believe on it very all the time because it's very variable, especially for women, right? Because of the cycle hormone fluctuation. What I like is that I wish for no, what I would say is that I wish that everybody here is gonna gain weight in the scale, because I want all of you and me included to gain weight, because we're gaining muscle and we are gaining bones and
Mm.
our bodies are getting leaner, right? So you're going to see your improvement in the mirror, in your measurements, in your energy, right? Yeah.
Yeah. I like that.
Me
Beautiful.
too.
Yes. Well, if we are at a good point, this might be a good point for us to stop and pause today. But Dr. Anna, I would absolutely request that you please come on again,
Yeah.
um, especially because I know several of our other members and stuff did not get a chance to kind of pass through, and so many people have questions.
Um,
So
I would love that. Unfortunately, I cannot do it on Tuesdays, but
it's okay.
I'm usually off. I would be honored to be here. Yes.
Wonderful. Well, we will definitely get that set up, and you are an exception on No Tuesdays.
I love that. And I would love for each one of you to support me on my
Mhm.
Instagram page, which is Ana Rosa Gratitude, and on my YouTube channel, which is Ana Rosa Gratitude, because my intention is to post short things on Instagram and then add some lives that would be up to 15 minutes that we could discuss the topics that the Instagram post of the week would lead to that. And if any of you speak Portuguese, I have a Brazilian page that is Ana Rosa Gratidão. Thank
Oh,
you so much.
beautiful.
We support each
Absolutely.
other, we hold hands,
Yes,
and I'm
absolutely.
really grateful to be here, and I'm sending a hug to you all.
Oh, yes. Lots of love. All right. So for everyone watching or whoever may watch
Oh
in the
yeah,
future.
oh yeah. Kiro is Key. Kiro is Key is the documentary that I am part with many other doctors that are amazing and brilliant. And Caroline and Kyle were the people who were
The
Producers.
making the
producers.
film. Yeah,
Yes.
the
Producers.
producers. Yes, the producers. So stay tuned. Kid Whiskey is coming, and keep spreading, keep sharing the light and the knowledge, knowledge with wisdom, not knowledge with noise, knowledge with signal.
Wow.
And
Yes.
on the side, on that same note, also the cholesterol code, right? Movie that is already there, and healing humanity that is already here coming as well. So let's
Yes.
just spreading our light.
Absolutely. Absolutely. All right, everyone. Thank you so much for being here. And until next time.
Thank you.